All right, so I think we can go ahead and get started today, and we'll just continue to admit folks as they come in from the waiting room. Thank you all for joining us for a quarterly DHS and OCI Healthcare Coverage Partnership Forum. I am Kelsey McDermott with OCI, and we'll be running the first 30 minutes or so of this meeting until Sarah Smith is able to join. We have a number of topics to cover today, including a public health emergency unwinding, a dashboard overview, open enrollment, and a preview for the January forum meeting. Just a reminder to please remain muted throughout the meeting. We'll have time for questions and feedback at that time. So we can jump right in with a public health emergency unwinding update from DHS.
Thanks, Kelsey. And my name is Ruth Sullivan. I'm the Deputy Medicaid Director with DHS, and I'll be providing our updates for today. We're going to focus on two primary areas today. One, just speaking a bit to where we are in terms of the public health emergency related to COVID-19 and our preparations for unwinding, and then also talking a bit about some of our communication and messaging priorities and activities over the next couple of weeks and months. You can go to the next slide, Kelsey. Thank you. So always like to start with level setting about what we mean by PHE unwinding, although I really suspect that most folks on this call are familiar with this term at this point. So when we talk about the PHE, we're referring to the federal public health emergency related to COVID-19, which was first declared by HHS in 2020 and has since been renewed 11 times. That PHE has provided, along with federal and state legislation, temporary flexibilities in the Medicaid program. And when we say unwinding, we're talking about the process we will go through when the PHE ends to unwind all of those temporary policies and return to standard operations in the Medicaid program. Go to the next slide. So just recently, the PHE was extended again, and the current end date is set for January 11th, 2023. If this is the last renewal of the PHE, states would expect to receive 60 days advance notice on or about November 12th of this year. So we are going to be looking closely at that date. And if we receive 60 days notice, the earliest that any member in Wisconsin would see a change potentially in their coverage would be the end of February with a January end date. So again, no special knowledge of whether or not this will actually be the final renewal of the PHE. We'll be watching closely in November. And if it is, if we do get 60 days notice, it'll kick off a series of unwinding plans, which we'll talk through a little bit in the next couple slides. So one of the policies that we've talked about a lot on previous calls that has had the biggest impact during the public health emergency has been continuous coverage for Medicaid members. So federal FCRA legislation put this in place to ensure people had healthcare coverage during the pandemic. And the federal legislation tied continuous coverage to enhanced FMAP that we've been receiving in Wisconsin. And this also was backed up by state legislation in spring of 2020 that's enabled DHS to maintain this continuous coverage throughout the duration of the federal public health emergency. We'll go to the next slide. So when the PHE ends, we have two main policy things to highlight on continuous coverage. So once the PHE ends, federal guidance requires states to maintain a member's coverage until we complete a full redetermination of eligibility for that member. At the same time, once the PHE ends, new applicants will be subject to normal program rules. Go on to the next slide. So again, when the PHE ends, so when we officially kick off the unwinding period, we will be spreading out our renewals over the 12 months following the end of the public health emergency. And evenly distributing them over that year will really help to minimize any peaks and valleys in future renewal cycles, as well as spread out the workload for IM agencies. And it also will allow us to really prioritize simplifying things for members by aligning their renewal dates wherever possible with other benefits that they have. Go to the next slide. Thanks, Kelsey. So that's just a really overview of things I think we've talked about before in this forum, and now I want to talk a little bit about some of our communication priorities and highlights. So right now, as it stands today, we have two key messages that we've been sharing in materials for members. One being you still have healthcare benefits and coverage, and we need you to keep your contact information up to date so that we can reach you when things change. And that includes emails, text messages, and mailing addresses. We've also been really promoting the use of the Access online portal and the My Access app through some social media campaigns and other resources for our partners, and eager to have all the help we can spreading the word about using these tools. They're both useful to members today and also will be important for us as we get into the unwinding. And we know that phone lines may have longer wait times as there's an influx of calls. So these online tools will be even more important for members to help manage their benefits. And our partner toolkit on the DHS website has resources and links about helping to share this information as well. And one area where we've been excited to see some success and want to just ask for everyone's help in sharing this campaign has been in a social media campaign on Tuesday tips for My Access, where we're putting out just tips for members about how they can use My Access, everything you can do in the app to really try to encourage the use of that app. And we've definitely seen an increase in new users as we've had that campaign out. It's been great to see, and every retweet and like from our partners helps. So just want to encourage that if we can. The partner toolkit, again, that I highlighted on the last slide on the DHS website has information about the campaign, so you can see what to expect and engage with it. Good. Thank you. And then I also want to talk about other ways that we're looking to communicate with partners and members as we get closer to the unwinding. So one area is that we have created a new email listserv for partners, and this is really aims to be a place to sign up to make sure you don't miss any updates, asking partners to share this with others, and this will be a place to receive news and information as the unwinding gets underway. We also have been working on ways to have resources and engage more with healthcare providers who will also be key participants in that member outreach and engagement and sharing of information during the unwinding period. So one place that we've created is a new portal on the Forward Health portal where specific provider resources will be hosted. So that includes messaging resources, materials, as well as some special reports just for providers that will be available after logging in that will help with some of that targeted member outreach. So this page is live now and will continue to be added to as we get closer to the unwinding. I think the next slide has just a brief preview of what this looks like. All right. And then when we are thinking about member communication, a place where we're really excited to highlight is that we're beginning to use text messaging and more email campaigns with members, as a way to really, we're still going to be sending out those written notices, of course, but this is an additional way to help highlight key information and actions that members need to take during the unwinding period. So really think this is going to be a useful tool into the future, but is also helpful in making sure members don't miss any of the updates as we get into unwinding. So our first couple of campaigns will really be about announcing that we're going to be communicating in this way and welcoming members to this communication. And this slide just gives a bit of a preview of what some of our messaging about this will look like. So definitely stay tuned, more coming in this space. I want to just wrap up today by providing an overview of some information that was shared on the last forum to give you a sense of, again, of how we're thinking about the messaging phases for unwinding. Today, we're in phase 1 of before the PHE ends, where we're continuing to remind members that their coverage is continuing and to please keep their contact information up to date. Once we receive that 60-day notice, that's when phase 2 would really kick off. At that point, we'll be pivoting our messaging to really getting the word out that changes are coming, letting members know what to look out for, what to expect, and sending out tailored specific information to members depending on their program. And then in the last phase of this is really that whole unwinding, sorry, Kelsey, that whole unwinding cycle where we'll be messaging tailored reminders about renewals, as well as a lot of support for members if they need to transition to another kind of healthcare coverage. All right. And then really for the final slide, just want to give a plug to the materials that we have on the DHS website for partners. This page will continue to be updated as we get closer to unwinding with pivoting messaging, additional resources, and just it's been so key to have partners sharing that consistent messaging in our collaboration so far, and this is only going to become more important as we proceed into unwinding. So thank you for helping to get the word out. And then the last slide, I think, is just a, if you have questions, this is our main email box, the DHS Forward Health Partners box, where we are collecting questions about unwinding. So really appreciate your time and attention today. And Kelsey, I see there's a few questions in the chat. I don't know if we have time right now for questions, if we prefer to save those for the end.
I think if we can go ahead and save those for the end, we've got a little bit of time.
Great. Thank you.
Thank you, Ruth. Okay, moving on to our dashboard overview.
All right, can you hear me?
Yep.
All right, very good. Hello, everyone. My name is Kelsey Avery. I'm Director of Policy and Operations with the Wisconsin Association of Health Plans. And I'm here today as the co-lead of the Partnership Data Work Group. And my co-conspirator, co-lead with this data work group is Nick DeMeo over with the Division of Medicaid Services. So we can go ahead and dive right in, Kelsey. Okay, so I've provided status updates on the data work group's efforts at previous forums, but today wanted to use our time to dive a little bit deeper, specifically into a resource we've been developing to help make data about healthcare coverage in Wisconsin more accessible and more usable by the average stakeholder. And we hope to make this resource available to the public sometime this fall or this winter. So we can go to the next slide. So we'd hope we might be able to give you an abbreviated demo of the dashboard for you today. Instead, we've just pulled out some screenshots to give you a taste for what will be available and what you'll be able to explore once the dashboard does in fact go live. So this first slide presents visualizations of data that OCI collects, which is related to the fully insured individual and group markets. For those of you who may have been following this at home, OCI began collecting this data a few years ago, more or less starting with the beginning of the COVID-19 pandemic. And so within this view, you will be able to see statewide enrollments in these fully insured products. And you can kind of see on the right-hand side there in that screenshot, you've got different commercial coverage types and counts across the top there, and that's statewide. And then you'll also be able to look at some specific regions, specifically rating areas, and then actually getting down to the county level for some large market counties. And you can't see it in this screenshot, but what's very cool about this tool is that you'll actually have quite a bit of flexibility to take a look at enrollment over different time periods for so long as OCI has been collecting the data. And again, I'll emphasize that this is fully insured products within Wisconsin. This isn't going to include any data for self-insured plans, short-term limited duration plans, or healthcare sharing ministries. We can go ahead and go to the next slide. All right, so this is a screenshot of a different visualization, which actually uses data that's collected by the Census Bureau through the American Community Survey, or the ACS. And this dashboard provides information about enrollment by coverage type and trends over time, as well as demographic information about people who are insured and people who are uninsured. And what's very neat about this particular resource is that it actually gives you quite a bit of information about different demographics of people who are insured and uninsured. And again, this is an example where you can look at data from multiple years, and the Census Bureau has been doing the survey for quite a while, so we'll be able to go back quite a few years. And there'll also be some flexibility to drill down to the county level. All right, we can go to the next slide. So this is a screenshot from a different resource. This is the Small Area Health Insurance Estimates, or SAHI for short. This is also collected by the Census Bureau. And the views in this dashboard will let you look at the uninsured and the insured rate statewide and in any county. As the name kind of implies, the strength of this data source is that it actually does let you get down to the county level. It also lets you look at changes in the number of uninsured individuals over time. And if we go to the next slide, you can see the change over time map is a little bit clipped in this, but you can see that there's sort of a heat map that tells you change over time at the county level. And then what this resource also enables us to do is to basically generate these top 10 lists with the number of uninsured residents and also the percent of uninsured residents. And again, this is a resource that you can look over multiple time periods as well. So this is really meant to be just a taste and a flavor for what's going to be available. Please keep an eye on your inboxes and in this forum going forward for some additional information once this resource goes live. And again, the idea is that this is going to take some data that right now is not all that user friendly and put it into a format that folks can go ahead and poke around and hopefully get answers to some questions that they might have in a much easier way than if you were going to try and scrape through data tables on the census website, as an example. So Kelsey, I think we got one more slide. All right. And I'm not going to spend much time at all talking about this, but I did at least want to acknowledge that the partnership has significantly contributed to a dashboard that's being developed by DHS to support outreach and communication efforts during the public health emergency unwinding. Nick DeMeo actually gave a very detailed presentation on this dashboard at the October 11th Unwinding Task Force meeting. So if you'd like more information, then I'd encourage you to take a look at his slides and the notes from that presentation, and you can go ahead and get a good sense of what's happening in that new resource there as well. And I think that's all I've got, Kelsey.
Thank you, Kelsey. All right, moving into open enrollment.
Okay, that's me, right? All right. Hello, everyone. I'm Stephanie Sievers from Covering Wisconsin, and I'm co-chair of the marketing and work group. So, and the sections on marketing and outreach, because so much of it goes hand in hand. So we'll start first with marketing. And just to remind everyone what when we come to the table in the marketing work group, we're really there to work together and make sure that we're reaching as many consumers in the state as possible. So we're really trying to co-create messages, think about who's going to reach what market, and divide and conquer as much as possible. So really a spirit of collaboration. Go ahead, next slide. So one of the things that we do is we come together, we create scripts and the messaging for a public service announcement campaign that is purchased through Covering Wisconsin with funding from CMS, but also supported from other groups. And this year, Common Ground and OCI and UW Health have chipped into that effort. Anyone else who'd like to contribute, you're definitely invited and welcome. Just reach out to me. So this is a campaign that it's a public service announcement. It runs via TV and radio, and it also has a social media component. And Nelson data shows that it reaches about 3 million consumers with the 10 weeks that we have. We have a much higher view of impressions, but that's the reach. And then we actually have a rough cut of the commercial. It's still undergoing the last minute editing pieces, but I thought I would show that here. Go ahead, Kelsey.
Do you need help paying for healthcare? As a health insurance navigator, my job is to help people find affordable or low-cost options. We find the best deals, whether it's from healthcare.gov or state coverage like Badger Care Plus. And you can reach us in person or by phone, text, or online. Call the 211 helpline or visit wiscovered.com.
Thank you. All right, and I wanted to talk a little bit more about some of the other things that are going to be happening in the state. If you could go to the next slide, Kelsey. Okay, so first, some traditional media that's been planned. And again, this is the spirit of collaboration. So a lot of this is happening with efforts from Covering Wisconsin, MCAN, and Partnership Community Health Center. And a lot of this is statewide, but again, there'll be some individual focus for different regions, such as the more urban centers like Milwaukee, Madison, La Crosse, Green Bay, Appleton, Fox Valley region. So there's quite a few kickoff press events. So far scheduled is Madison, La Crosse, Milwaukee, Appleton, and Green Bay. In Milwaukee, in various locations, there'll be DMV videos. There'll be bus placards going around cities in La Crosse, Milwaukee, and Madison. There's going to be a billboard campaign in Western and Northwestern regions. There's rural newspaper ads, and those are really going to be focused in the regions where we know our public service announcement campaign is just not quite reaching very well. Very rural regions who may not have as much access to different radio and TV stations. So we're doing a lot of rural advertisement there. And it's very much focused on who's your local navigator, who can you reach out to. We've had really good luck with that last year. So we're very much expanding that effort into a lot of different counties this year. And so that'll be large swaths in Western and Northwestern. And then also all the northern region. So, and some of the central that are very rural. There'll be a Spectrum cable ad buy all through the Fox Valley region. That's the first time any of us are doing that. So we're excited to see how that goes. Milwaukee might have done that in the past, but and then additional, additional radio ads in Fox Valley. Okay, so that's more the traditional media. And then in addition, in the next slide, we have the digital media. So what's really exciting about digital media is we can target it. And so we can target for age, income, gender, or I should say sex, a lot of things can be targeted. And so if we have something we've developed for a young male audience, we can run those ads with people who would fit that profile. And so a lot of creative has been coming out. We're still producing it, as most of our campaigns will start after the election. So there's a lot of targeted Google ads. So maybe you've done a search for health insurance in the past, and then maybe you go onto another site and you'll get an ad about how to find local help to get enrolled in health insurance. We'll do some streaming audio ads in different types of platforms such as iHeartRadio, Spotify, etc. Social media ads such as Facebook and Instagram or TikTok. And then this year we're going to do a lot of social media influencers. I know last year there was a pretty good campaign for that in the Milwaukee region, and this year we'll do more of a statewide effort for that. So we'll be engaging influencers on Facebook, Instagram, TikTok, and any other channels that are popular. And the other thing is a lot of those messages might be the importance of health insurance or personal experience of I reached out with this person and they helped me sign up and it was amazing. I learned so much. So lots of different storytelling there. And then once people create that content, we can also repackage that and create a new ad to send out in a different way. And then we'll also be doing some ads via video streaming, such as YouTube or Hulu, Sling, just various channels such as that. And here on the right, there's some of the creative we've already got squared away. These are actual videos or GIFs. We've got some fun ones that are like with a Simpsons theme, even with a Simpsons impersonator for Homer's voice. There's another one with Bob's Burger theme. So a lot of fun stuff is coming. So I'm really excited. And then last, so this was the most creative idea to come out this year from all the different partners. And IMCAN is doing a really fun idea of, they created some beautiful artwork that looks almost like a mural. And so they're going to be making posters and putting them up all around boarded up buildings throughout the Milwaukee area. And so we thought this was a really fun idea. It beautifies and informs all at the same time. So, okay, and I'll let Courtney finish up about outreach.
Thanks, Stephanie. And for anybody who didn't see, I'll put in the chat, but recently OCI released a new study analyzing the health insurance marketplace in Wisconsin. And one of the key takeaways from an outreach perspective that I think we saw from that was that in addition to this really wonderful sort of broad-based promotions work, we continue to see reflected in the data the need to work with really trusted local individuals and partners throughout the state to have those one-on-one conversations to bring folks in to find local help and to increase awareness of these health insurance options. So in the outreach and education work group, of which I facilitate, we focus on taking a lot of that beautiful creative and those really great hooks and key messages from our marketing partners and strategizing around how we can get these materials out to some really key partner groups and directly to individual consumers through events and other venues, so that we can have some of those one-on-one conversations and bring folks into the fold. So in addition to some of those broad-based promotion Stephanie just shared, we also wanted to re-share and remind everybody about the outreach toolkits we have available across the state too. So on the screen here, you see Covering Wisconsin's toolkit. In that toolkit, we have materials in both English and Spanish. We have ready to use social media graphics, and then also outreach cards and flyers that can be downloaded right from our website, but you can also reach out to us to contact them and personalize with your local enrollment assister contact information and logos and co-branding, things like that, that we know really help these materials resonate more locally. And then on the next slide, we have our partners at OCI who also put together a really wonderful toolkit. And as you can see, we work across the partnership to use similar key messages, but to have materials that have sort of different looks and feels so that our partners have options of the types of resources and also the sort of graphics and creative they have to choose from to use locally. So OCI's toolkit is live now, and we'll be continuing to add resources over the coming weeks. And you can see several of their examples on the slide here. And then on our next slide, we have an example of our MCAN Partners Toolkit, which will also be released and available to folks in the Milwaukee area with a lot of that great creative too. And they plan to have that up by November 1st. It'll be on healthymke.com. So keep your eyes on that website for their toolkit later this month. And then I know Ruth mentioned this earlier, but the liking and sharing of our social media posts really does have a huge impact. It doesn't just, spread the wealth amongst your followers, but also all of us when we do paid boosts and other ways that we're kind of helping to spread our own social media posts. The more engagement we have from partners like you all really help the posts to go even further. So when it comes to exactly, Aziz, spread the wealth. So on the slide here, you see several of the accounts that you can follow and engage with that are going to be specifically posting around open enrollment and healthcare.gov. We have Covering Wisconsin and OCI, of course, on a statewide level. Our partners at Healthy MKE from Milwaukee specific perspective. And then healthcare.gov has both their regular healthcare.gov page, but also cuidadodesalud.gov has its own page that is posting content specifically in Spanish. And then I just have a couple of other quick reminders on an outreach perspective. So of course, our creative in a lot of these kind of broad-based promotions, the toolkits and our social media messages, they have those really beautiful images and kind of hooks and key lines to get folks drawn in. But then once you are talking to a consumer as a partner, or you're out in the community as an enrollment assister, Covering Wisconsin also puts together and has released for this year some important messages for consumers to just kind of hit home some of the key messages and pieces of information that we want everybody to keep straight this year going to healthcare.gov. So reminders, of course, around the time frame to get enrolled, November 1st through January 15th, but that key date of December 15th for coverage to start January 1st. A reminder about the extra financial help that's available on healthcare.gov. And in the talking points, we also speak to the kind of fix to the family glitch and the fact that more family members will be eligible for financial help this year. And then, of course, our perennial reminders about the public health emergency continuing and what that means for Badger Care and Medicaid members, and a reiteration of the safety of accessing these benefits for immigrants and their families. And then finally, that there are more health insurance enrollment assisters available this year to help. So as our partners, you don't need to be the experts on these points, but we do have some, just a one-page document to help you sort of stay on message and then help you connect consumers to our enrollment assisters throughout the state. And then finally, just a couple of other reminders. If you, like I said, if you need materials, if you have questions, particularly with the Covering Wisconsin materials, just a reminder that you can reach out to me and we can get those materials tailored for you. And then I believe the last slide I have is just a reminder of all of the ways that you can connect folks to an enrollment assister locally. So like our video said earlier, you can find us online, you can give us a call, and you also can now find us via online web chat and text via the methods on the screen there. So when these slides go out, just another reminder of how you can find and connect folks with your local enrollment assister.
All right. Thanks, Courtney. And I'm going to jump in here. I'm Sarah Smith with OCI. I typically launch these meetings, but I'm sorry I missed the beginning of this. I wasn't able to do that, but I'm on to give our agency update. So this slide probably looks familiar if you were on our meeting last time. This is just a recap of the state flexibility grant. Oh, sounds like I'm quiet possibly, so I will try to get closer to my mic here if you can hear me better now. So this is the recap of our state flexibility grant that we were awarded by CMS. So our total award amount there, $689,000-ish, is provided through September of 2023. And the intent of this grant was to produce 3 different reports that would help us better understand and address health insurance market needs in Wisconsin. So for consumers here. Oh, I'm sorry about that, everybody. Let me, 1 second. All right. Can anybody hear me better now?
A little bit.
Okay, I'm holding my laptop up to my face now, so hopefully this will work. All right, so just as to move on to the next slide quickly, but just this is a recap of the grant. So the first report that we were able to produce because of this grant funding that we were awarded by CMS was our market analysis, aka market scan. And so these are a few of the takeaways that the OCI Public Affairs team found very useful in that market analysis for our marketing campaign plans for open enrollment. So some of the things here, about 1/5 of uninsured adults report that coverage was not needed or wanted. This was more often true for uninsured men, 26.8% of uninsured men, than it was for uninsured women. So that was a particular takeaway that we found should inform our efforts to target that population of uninsured men. Another takeaway we had was 62.6% of people in Southwest rural Wisconsin were unaware of lower premiums on healthcare.gov. And 58.3% of people in North Central rural Wisconsin were unaware of the lower premiums as well. So from those two takeaways, we felt like it was a very positive result in Madison and Milwaukee, but clearly that there were more opportunities to spread the word in more rural parts of the state, and particularly in that North Central and Southwest region. So that's one of the things that we've taken really to heart as we planned our efforts as well. The other major takeaway we had was Latinos in Milwaukee are the largest share of uninsured people in the area, with over 20,000 uninsured individuals in this group. And then another takeaway we had, which was more looking at underinsured rather than uninsured. So we found that adults aged 54 to 64 were enrolling in bronze plans at much higher rates than they've been enrolling in silver plans. And in general, we've seen trends based on this market analysis report that showed us that more people have been trending toward enrolling in bronze plans and fewer people enrolling in silver plans. And so that was an area we wanted to target as well, to just encourage people to really consider their deductibles and copays and the other aspects of paying for their health care that wasn't just their premium cost. You can go to there we go. So that first one I mentioned, these are the statistics there. So I just wanted to kind of go through then the main audiences that we are going to be targeting with our marketing effort from OCI based on the data in this market scan. So that first group I mentioned, we've created the first audience that we'll be targeting, which is the uninsured young adult men. So we drilled down into young adult men because of that second graph there. So when you're looking at the uninsured age range, there's a significant portion of people 19 to 34 that are uninsured. And of course, anything we can do to bring that typically healthier population of people into the market, the better. And so this is one of those populations we're going to be targeting pretty heavily, the uninsured young men, and really making them consider the need of health insurance, and then hopefully drive them to healthcare.gov to get enrolled in that health insurance. And so the next population was the uninsured adults in rural Wisconsin. So these are the graphs kind of showing you the statistics I mentioned earlier. So we have both the question, how much have you heard about healthcare.gov? And then the question that I had on the previous slide of how much information they had on financial help available. So if you even look at just the basic, have you heard much about healthcare.gov? You can see some pretty big differences. So in Milwaukee, for example, 35% of people have heard a lot and 38% of people have heard some about healthcare.gov. But if you look at, Southwest rural Wisconsin, only 11% of people have heard a lot, 34% have heard some. And so we see, much higher numbers of people in those rural areas and in the Fox Valley that have heard little to nothing about healthcare.gov just in general as a platform. So that's a population we wanted to target just generally to raise awareness and make people aware that there are resources for them available to get enrolled in coverage and targeting, or driving them toward WIS covered. And then this graph just outlines that other statistic I mentioned. So this will be the third population that we are targeting, uninsured Latinos in Milwaukee, to make sure that, we are sharing information, sort of some of the things that Courtney touched on in her slides earlier, that public benefits are safe to access and immigrants are eligible for public benefits and things like that, just to to try to dispel some of the notions that may be persisting in some populations in Milwaukee, and particularly in Latino populations. So we can encourage them to talk to an enrollment assistant, talk to a navigator, and really learn about what their options are to get covered. And so that's one of the things that we're going to be focused on doing, which will of course be, then also making sure that all of the content and materials that we are producing for this group are translated into Spanish as well. And then finally, that last statistic I had mentioned on that earlier slide was the underinsured adults. And so this is showing that trend, this graph on the upper left, the plan selections by meta level, that just generally across enrollees showing that trend of decreasing enrollment in silver plans and increasing enrollment in bronze plans. So we're just trying to, share some more information with consumers, and particularly looking at that older population of 55 to 64, but we're going to target a little lower than that, make it a little broader, the 45 to 64, just to make sure that people are thinking through all of their options when they are considering their active re-enrollment process once open enrollment begins, to really look at the cost of their deductible and other costs associated with their health plan beyond just the premium. And that's part of why too, we're going to be really not that we're driving everyone to navigators, but driving everyone to look at talking to a navigator, a broker, an agent, just to talk to an expert who can help them think through those additional costs and all the things that they should consider when they're looking at enrolling in a plan. And so here are the some of the marketing mediums that we are planning to utilize for this marketing effort. We have, of course, billboards, radio. Those are going to be two really important areas for us when we look at that, the issue that the market scan outlined in rural Wisconsin. So recognizing the lack of broadband access in many of these areas, recognizing that particularly in that northwestern quadrant, which was noted in the survey, they typically get Minnesota news. So in terms of the network news, and often even the newspapers they get are out of Minnesota. Billboards and local radio stations are a good way for us to really get directly in front of those consumers without, spending money in Minnesota markets, or creating more confusion when they're getting information about Minnesota enrollment. So those are some of the things we're really going to be focused on. We also have music and podcast streaming. So think Spotify. We're going to be doing bus wraps in Milwaukee. We're also going to be doing some YouTube, Facebook, and Instagram. We're throwing Reddit in there, and that's a little bit of a different platform than we've typically advertised on in the past, but that is because we're trying to find mediums that are places where our targeted consumers are going to be. And when we're looking at that uninsured young men, Reddit's going to be a place for us to be. So like Reddit and YouTube, those are particularly two good platforms for that, 18 to 34 aged young men population. And then of course, for all of our populations, we're going to be doing some sponsored Google search ads to make sure that we are showing up before some of the other types of plans like healthcare sharing ministries or other things that might be advertising at the same time, so we can get them to a navigator or generally look at the information on what's covered before they end up going to a different plan that's not an ACA plan on healthcare.gov. And finally, very similar to what Stephanie had talked about in her slides too, we had planned on pushing our campaign to start on November 9th or after to avoid the higher ad costs that are really being driven up by all the political campaigns. So we'll be posting, passively on social media before then, but we won't be using any of our dollars from this marketing campaign until beyond November 9th to make sure that we are using them the most efficient way that we can. We're going to really try to move consumers from awareness to conversion. And so we're doing this in a staggered fashion as well. And so for November, December, we'll be building awareness with things like the ads on billboards, for example, some of our radio ads. And then December to January focused on creating the opportunities for direct action. So knowing first that consumers typically are more likely to enroll toward the end of the open enrollment period because they all seem to be procrastinators, much like myself, that they're going to be getting enrolled at the last minute. So trying to get in front of them when they're likely to get enrolled so they talk to a navigator, but also giving them that direct click-through opportunity. So instead of, driving by the billboard and having to remember to call 211, or some, whatever the case may be, they would see it right on social media to click through to Covering Wisconsin, or see that on a streaming platform, wherever they might be. So that's the way we're sort of staggering it out. So all of our marketing efforts are not going to be, continuous November 9th to January 15th. We're trying to create a real strategy within that. So here are some of the content examples. So we have a couple examples here in the middle of bad ideas deserve good health insurance. That was stolen from our Covering Wisconsin friends and Aziz. But we really love that phrase and think that that'll be a really great one for targeting that uninsured young men population. So you can see some of the examples there of potential billboard ads we could run with that phrase. You can see a bus wrap example in that upper left there, that yellow 4 out of 5 people got financial help with their health insurance last year. So that's going to be one of the bus ads we'd be running in Milwaukee. We have this additional billboard design for immigrants can apply for health benefits too, kind of trying to tie in that the really audience specific messaging so that we are talking to that uninsured Latino population in Milwaukee particularly. So these are just some of the examples that we have been mocking up so far for the marketing campaign we'll be running. And this is just a reminder about our toolkit. So we have some videos and these graphic examples for social media. We have the flyer design. You can see one of those examples on the right. So all of these are available, wiscover.com/media toolkit. And you are welcome to pull, whatever you'd like to share. We also have social media text there, so that hopefully it will make it easy if you'd like to use any of this material on your social media platform to just copy and paste all of that.
We needed to always.
All right. So are there any questions on our agency updates and the marketing campaign from OCI before we jump into the last part of the forum? I don't see anything coming into the chat, so I think we are good there. You're welcome to reach out to me if you do have any, and thanks Aziz for that kudos. Kudos to you as well. Thanks for letting us steal your message on bad ideas deserve good health insurance. So, all right. So then just a couple of things on the January forum preview. So our January forum is planned for Monday, January 23rd, 2 to 3:15 as always. We'll continue to talk about the public health emergency unwinding planning and may have a chance to look at some initial results from the open enrollment marketing efforts that we've run, just to kind of see some of the numbers we might have. I don't know if we'll have many enrollment numbers at that point, but we can at least look at some of the maybe end of 2022 enrollment numbers and see what our impact has been so far. And you can go to the next slide, Kelsey, if you can get it. There you go. Yeah, so on that note, if there are topics though that you would like to see us cover, you are welcome to enter ideas in the chat right now, or even unmute yourself if you want to share some ideas. If you'd like to think about it more, or if you have something comes up later, you're welcome to email me there to let us know. We're trying to make sure that these forums are sharing the information that you'd all like to have. so that they can be really as impactful as they can for all of the wonderful partners we have in this healthcare coverage partnership. So I'm going to watch the chat for a couple seconds here, see if something comes in. And it looks like there were maybe some questions in the chat from prior to me jumping on. So unfortunately, I'm not able to see the chat prior to the point that I joined, but Kelsey, do you think you could read out those questions from DHS's presentation to see if Autumn or others from DHS could address those questions?
Sure, I'm happy to. So Teresa had a question. When you mentioned coverage change, are you referring to premium and review change?
Yeah, this is Autumn Arnold from DHS. Ruth had to hop off for another meeting, so I will take that question. So when Ruth talked about end of February being the earliest that anyone would see a change in their coverage, we're really thinking about there was the beginning of March would be the first that someone would see potentially see an end to their Badger Care Plus or Medicaid coverage. We have also, as I think this group knows, been suspending premiums for all of our premium paying members in Badger Care Plus and Medicaid during the public health emergency. And those policies will also be unwound during the unwinding period. The timing is a little different though. And also, I just want to acknowledge that this has been an area where our guidance from CMS has continued to evolve. And so you may have been in other meetings where you've heard different things, but our current plan, which is still somewhat subject to change, but we're hoping is finally settling, is that for all of our premium payers, which would be MAP members above 100% of the FPL, children above 201% of the FPL, and childless adults above 50% of the FPL. For all three of those groups, premiums would be reinstated as of the first calendar quarter after the PHE ends. So with a January PHE end date, if that ends up happening, we would be talking about April 1st. April 1st would be the first time that new applicants would need to pay a premium in any of those groups. And for any existing members, we would reinstate premiums as of their next renewal. So again, this has been something that's been changing and evolving, but that is where we stand today. I'll just pause to see if that answers the question. If anybody has any follow-ups on that. Kelsey, I can also address the question that came in about when are we notifying people about their next renewal, or about their post PHE renewal. And if you'd like, I can also read that question.
That would be great. Autumn.
Okay, so Hannah says, I see on the unwinding messaging phases that DHS plans to tell members about their renewal date in phase 2. And the question is, will all members receive notification of their future renewal date immediately when the PHE ends, or will they receive this notice 45 days before their renewal date, like they did before the PHE? And the answer is both. We plan to send an official letter to all of our members, letting them know how they'll be impacted, what they need to do, and when they need to act. And that includes a notice letting members know when their renewal is scheduled during the unwinding, once we know, once we've redistributed renewal dates and we know when that is. So they'll know, is it coming up right away, or do they still have another, 8, 9, 10, 11, 12 months? And then when their renewal is 45 days or thereabouts, away from being due, we'll send them the standard 45-day renewal packet that they would normally get. Okay. Just keeping an eye on the chat here. I don't see anything else. And then I think I'm going to kick it over to Lars for the question about the text and email messages.
Hi, everybody. My name is Lars Brown. I'm also at DHS, and Jonathan asked in the chat, are you able to specify the time frame for the department's email and text campaigns? So we at DHS are going to be utilizing texts and emails as another way to reach out and remind members of important actions that they need to take to use and keep their benefits. And Maciel shared the notes from our last task force meeting. So I'm going to share those, and thank you, Maciel, for sharing those with me. So actually coming up in the next week or so, we plan to start our first texting and emailing campaign. And that will include announcing text and email to current access users, as well as welcoming new access users. And the materials, and I think this is pretty important, and a question that was raised in other areas today as well. Those materials that partners can use to help spread the word that DHS will begin to text and email members directly can be found in our partner toolkit starting next week as well.
And then I see a follow-up question from Hannah, which is, will IM agencies be doing renewals for members ahead of their renewal date if they call as a result of those first letters, or will they be pushing them back to their actual renewal date? So the messaging for IM agencies is going to be that if a member calls because they get that first letter and they want to do their renewal, we really need to discourage them from doing that. It's not in the member's best interest to do their renewal early. And so they will be, as you say, pushing them to wait until their actual renewal is due.
All right. I'm just looking to see if there are any other questions coming in. I don't see any others coming into the chat. Thank you, Autumn and Lars, for handling those responses. So then I think we can wrap up a little bit early today. We really appreciate all of your time and continued participation in this partnership. Please do reach out to me if you have ideas for the January forum, anything you'd like us to cover, anything you'd like to hear any more information about from our two agencies or other partners, stakeholders in the partnership. We'd be happy to consider any of your ideas to make these the most useful meetings they can be. So thank you, everybody. Have a good afternoon.